My name is Alice Muyama. I am from Uganda in East Africa. And beside me is Jairus Nkerewe Makinon. Jairus is 8 years and is my grandson. Jairus had challenges. He had sickle cell disease and he was really struggling with life. We came to Apollo Hospital on 24th November 2019 and we started getting the treatment. It wasn't very easy. I really want to take this opportunity to thank the hospital team led by Dr. Gaurav. It wasn't very easy, but they encouraged us. BMT itself, that is the bone marrow transplant procedure. It is a very good procedure. Everybody who is involved in this is really very, very busy. There is teamwork here. The transplant was done. Jairus has never complained again of the joint pains like it has been before. But since after the transplant, that one has disappeared completely. And we really have hope that it will work for us. Who is suffering with a child with the same challenges to come and do the transplant? It can really give a lasting hope. I am now very happy. By the grace of God, Jairus has fought it through and is recovering steadily. We are happy. Finally, I want to appreciate Dr. Gaurav and his team of the doctors, the nurses, the housekeeping team, the drivers, the dietitians, so many people around this. The people who have been in the billing section in accounts, people who have been working on the tests in the lab, Mr. Rohit, Madam Himushika, and many others who have been with us through this.
Greetings from Indraprastha Apollo Hospital, Delhi. I am Dr. Gaurav Kharya. I am the Clinical Lead Center for Bone Marrow Transplant and Cellular Therapy. You have just met a little chirpy boy by the name Jairus. Jairus is from Uganda, and as you might have heard from Jairus and from grandmother, Jairus was suffering from sickle cell disease since early years of life. So when he was around 6 months of age, he was diagnosed with sickle cell disease, which manifests clinically in the form of bone pains, fever, anemia, jaundice. And since then, Jairus had multiple problems, including multiple episodes of infections, pneumonia, pain crisis, osteomyelitis, requiring multiple transfusions. So with all these problems, Alex, who's Jairus' father, and mom, who's a doctor by profession, they got in touch with us and discussed about the curative solutions. So we told them that as far as sickle cell disease is concerned and severe symptomatic sickle cell disease is concerned, the best possible solution is by offering a bone marrow transplant. Jairus has 2 siblings, so we screened both the siblings for genetic compatibility, which is done by HLA testing. But unfortunately, both the siblings were found to be haploidentical, that is half matched, that is less than 90% HLA identical. So we discussed with the family and then we decided to go ahead with a haploidentical transplant using sister as a donor. His transplant had 2 months of preparation before the transplant, and after that he underwent transplant, and now he's around 4 months post-transplant and he's doing very, very well. His transplant was uneventful. It required a lot of preparation, but by God's grace it went off well, and you have just seen him 4 months post bone marrow transplant doing very well, and I wish him all the very best in future life. Thank you.